Ladies and gentlemen, I would like to introduce our next plenary session for that will talk about the integration of that system. I would like to invite to go to the stage first as Honorable Mr. Mohan Basnet, the Minister of Health for Population of Nepal. Please, thank you. That you give us the final conclusion remarks. And Dr. Vinod Paul, that will be our keynote speaker. Dr. Stefano Maziero from Italy. Dr. Chido von Schoen-Ungerer from Switzerland. Dr. Heather Boone from Canada. Dr. Ton Hai from Thailand. Dr. Nesma El-Nabari from Egypt. Dr. Sekaya Kagali from Uganda. And Dr. Maria Enand Sumiwi from Indonesia. Please. Thanks. Please, the presentation, please. Where you are? We are in the second day of the Global Summit of Traditional Medicine. After discussed in the first day, the planetary health and the well-being for all, the country data and global evidence, important parallel sections like mapping of evidence, workforce of development, and innovation. And now, today, we have a wonderful plenary session about digital health frontiers. And now we'll go to the integrative healthcare, well-being at all ages. Where you come from? Here you have the names of our speakers that include all 6 regions in the globe. Then we have a representative of examples of integration internationally. In reference of my country, I'd like to show and do a reverence to the indigenous population in that area, connected completely with the nature, and show that in our region, we developed in America a big network connected with the virtual health library of the PAHO that gather several countries. Then you can connect in the QR code to the exhibition where presented all that experience. To start, I'd like to say that we have a very interesting video statement from the former director from WHO, Dr. Gurujat Mutalik, major proponent of integrative medicine, that talk about the narrative of personal experience, the role and importance of traditional, complementary, and integrative medicine well-being across the life course. Then let's go to the video from Dr. Gujarat.
Namaste. Distinguished participants, ladies and gentlemen, I feel most privileged and honored to have been invited to address such a historic assembly of global and national stakeholders of health. I'm a 95-year-old unretired physician. For 75 years, my good fortune provided me opportunities to serve the cause of integral medicine as professor of medicine, medical genetics, dean of a medical college, director of health services in a major state in India, WHO service as a senior director in 3 continents for 18 years, a practitioner of Ayurveda, yoga and meditation, and mind-body medicine. I have also been a patient with an intensive care unit and survived a health crisis because of temporary lapse in my lifetime management, including neglect of exercise and yoga practice under a stressful period, but quickly and completely regained my lost health with help from my knowledge and experience and lessons learned. Today I have better health than most of my peers, and I still walk and jog 2 miles a day and work for 8 to 10 hours. My message to this August gathering is simple and urgent. The amalgam of modern medicine, with its strengths in scientific rigor, experimentation, continued innovation, and evidence base, blended with basic practices of life drawn from Ayurveda, yoga, and traditional medical systems, must evolve into an integrated medicine of tomorrow. Integrative approaches are no longer be complementary. In fact, taking this approach is the only possible way to heal our sick planet. The crying need of our age is to empower traditional medicine to imbibe power from basic sciences and emerge dynamically from its static state. In our sick planet today, despite all past gains, my miracles of medicine, chronic diseases continue to take millions of lives prematurely. Cancer alone causes 10 million deaths a year. Modern medicine seems to have no answer. I have to think that the answer lies in the integrated medicine of tomorrow, including the advances of genomics and epigenetics. I hope and pray that under the leadership of WHO and your own involvement and advice, we will execute this master strategy to accomplish the integrative medicine objectives. Om Sarve Bhavantu Sukhina, Sarve Santu Niramaya. May everyone be happy. May everyone be free from all diseases. A prayer of the ancients. Wishing you Godspeed in our far-reaching mission. Thank you. You Godspeed in our far-reaching mission. Thank you.
What are the aims and needs of that such important plenary? From the past, learn from the speakers the good practice model of integration into member states' health systems. From the present, promote mutual understanding and communication for integration. What our aim to the future? Promote that the successful experiences of each country can be globally expanded to other regions of the world, and monitor the 6 building blocks of traditional medicine integration process over the next years in the 6 regions of the world through a periodic evaluation information system. This just to announce the 6 building blocks that will be very well brought from Heather Boone in her talk. It's about leadership and governance. That's the importance that these events are connected directly with the G20. Health system financing, that also connected with the governments and support. Health service delivery, mainly in primary health care, clinical practice and research. Health workforce that connect directly with education and research. Health information system with the important topic about ICD-11 to include in information system and research, and health products, vaccine and technology that are connected directly with innovation. Then the main question to our speakers and to the audience, considering that the traditional medicine is prevalent in 170 countries, we all agree that at the basic level, integration of this traditional complementary medicine with conventional medicine is taking place at different levels in the 6 building blocks. 3 questions. What are the real benefits for society of your model in your country? Do you think TCIM or TCIH would help achieve the universal healthcare goal and sustainable development goal? What is your vision on the integration of traditional and complementary medicine and conventional medicine? The other main question, do we agree that simultaneously formalization at the level of policy, regulation, education, research, products, and clinical practice needs to be pursued to effectively manage integrative health interventions? Considering that evidence-based integration is the need of the moment, how do you envision the strategy to implement this integration, both in our country, regionally, and globally? To that main questions, I would like to invite the first keynote speaker, Dr. Vinod Paul, to his honorable member of NITI Young, government of India, that will talk about his perspective that is very broad. Please, Dr. Vinod Paul.
Very much. Thank you. Can I have my presentation on? Thank you very much. Namaste. Respected moderator, Dr. Gelman, distinguished panelists, and audience. I bring to you the greetings of Niti Aayog, which is the National Apex Policy Think Tank chaired by the Honorable Prime Minister. And I'm going to share with you some work that is being done in order to bring different systems of medicine in mainstream and to make the best use of this in improving the healthcare of people. Well, just to set the stage, it has been already stated that India has a long, ancient tradition of its own traditional medicine system, which has been curated by some of our most revered sages. We bring a plethora, a bouquet of traditional medicine themes, domains. Of course, the most famous, and rightly so, is Ayurveda, Yoga, naturopathy, and we also have very well established Unani, Siddha, homeopathy, and also Sovarippa. We have a vibrant Ayush healthcare system in terms of physicians, more than 750,000. There are 789 Ayush colleges, training institutions. There are thousands of hospitals, clinics, and also very vibrant export of our traditional products. Pharmacopoeia in different pathies is also available. I'm very proud to say that that Ayurveda is used in 93 member countries of WHO. It is formally recognized in 18 countries, and in 5 countries, it is Ayurveda also is covered by insurance systems. Well, our way forward for integrative medicine in India is being guided by the Honorable Prime Minister's statement and a quotation that I like to state here. I quote, "To transform the healthcare system of the country and to develop a healthy society, there is a need to think holistically and integrate the traditional and modern medicine for sustainable." This drives us to work in the area of bringing the systems together in the interest of the citizen, interest of an individual. So thematic work on this area has been undertaken at Niti Aayog. And let me start with the definition that we thought is the balanced definition, comes from Gita's suggestion during those discussions, but I love it. Integrative medicine is mutually supportive medical system working for the common objective of serving people in the spirit of mutual respect and teamwork. This we thought is a good way to start discussion around how to work, how to bring the systems together. We believe that working together is greater than the sum of the individual pieces. We believe integrative approach reduces cost and increases the coverage. It strengthens the primary health care and takes us closer to the universal health coverage. So instead of working in random ways, we work together according to set rules, respecting each other, we surely would gain more health for the people. I like to now dwell on specific steps that we can take to bring the systems together. And this comes, as I said, from the discussions at Niti Aayog as general principles that appear relevant to definitely to us, but I believe for other nations as well. Education. Starting with education. So we believe that teaching on selected domains of each system should be undertaken in the undergraduate courses of other systems. So the physicians respect and recognize the other system, and they have some understanding of the underpinnings of that system. This is one suggestion we believe could make a difference. Second, we should consider bringing at some point going forward with an integrated degree for the graduates of any of the pathies and bring them together into a, let's say, a family medicine PG program. I'm happy to state that at least for the first one, action has already been taken in India. Yoga is part of the the foundational course which imparted to undergraduate students in MBBS in the first very month of their entry. And then there is an internship which is now essential for the graduate to in another system. There's also a mechanism in the law which talks about coming together at the regulatory level to be able to find solutions toward working together, and that's enshrined in the National Medical Commission Act. So we created a mechanism to work together at the education level, and as I said, in the system, in the modern system, an exposure, a systematic exposure has already been introduced. Second, clinical practice. Clinical practice, the think tank that worked on this area believed that the way forward is not just cafeteria approach, where services are available and individual patient can pick up the services that he or she likes. We would like to move in the direction of a complementary approach where a treatment protocol will be developed by agreeing by the leaders of the concerned systems, and then the doctors, the treating doctors of one or the other, would guide the patient to take up the advantage of another system when the time arises. We would like to call this as a complementary approach. So it's complicated just to show how it will work in diabetes, but just to say that you start with, let's say, on the green, on the red side, with the modern medicine. At some point when the difficulty arises, you could be advised by the physician that you may like to now move, let's say, toward Ayurveda and so on. So this could be the way forward, but we need to develop these integrated protocols through an agreement and consensus. Co-location of facilities is another recommendation to promote integrative care. And I'm happy to say that in India, thousands and thousands of our district hospitals put together, district hospitals, sub-district hospital, community health posts, and private sector institutions have co-located facilities. And this is a very vibrant system. More recently, our All India Institutes of Medical Sciences, 20 of them, have agreed to have an academic department of Ayush, one of the Ayush systems, in their own institution as a full-fledged, co-located, and integrated department. In terms of public health, which is a third domain that I like to touch, we would like to suggest that the primary healthcare work and the programs of nations should have part of it should be an agreed domain of traditional medicine. In India, fundamental activity, an agreed activity on yoga, for example, then there is a possibility of having for national programs integrated protocols. We would believe that bringing together public health workforce which emanates from different systems and working together will also promote the cause of integrative public health delivery. We also believe that we need to sensitize professionals of one system to the assets of the other system, and back and forth will be very important, and to promote this at the community level will be important. And then the health management system, health information management system should also align, because that's how the programs are monitored. So bringing together some of these principles could be the way forward to bring integrative alignment of integrative medicine in primary healthcare space. Lastly, for research, the way forward is to identify high priorities where integrative research can be undertaken. And we believe clinical trials and clinical studies are a high priority straight away. The systems are legal, the options that have a promise should be tested systematically. Then there is a possibility of looking at the mechanistic features. There is a possibility of testing the protocols, clinical protocol that I talked about, and primary health protocols for their effectiveness. These would be to us high priorities to bring integrative approach in mainstream of clinical and public health system. I strongly believe that all the leaders and the academics of all these systems should be trained in the modern research methodologies and biostatistics, and the way, in particular, to conduct clinical studies and clinical trial. This will make a very major difference and bring the terminologies together and help the cause of integrative medicine. Integrated MD, PhD programs and research fellowships are other suggestions. We need to build centers of excellence where systems come together. And we recently have an MOU from the Ministry of Ayush and our new AIMSs to be able to do so. We, of course, need to invest resources into research, and we indeed have to make sure that there are career pathways for researchers which give their life and time for integrative research. These are some of the suggestions in 4 domains: education, practice, public health, and research, which we believe would help bringing together the systems into an integrative approach for the benefit of humanity. Thank you very much. Jai Hind.
Thank you very much, Dr. Vinod Paul, for bringing that 4 perspectives of integration. And I'd like to just to invite everybody, just after conclude that plenary, we have a 5 minutes yoga activity. I invite everybody to stay here just before the lunch. Now we move to Italy. I'd like to invite Dr. Stefano Mazzero, full professor of chair in the Neurorehabilitation Department and director of School of Physical and Rehabilitation Medicine in University of Padua, to bring your perspective in the field of neuroscience. Thank you.
Thank you, Ricardo, and good day, everyone. And thank you for the opportunity to attend, to share with you my experience. The global increase in the chronic diseases and disabilities poses significant challenges to our healthcare systems. A recent World Health Organization resolution on May 2023, recognizes the importance of enhanced rehabilitation to provide dignity and better quality of life to people with disabilities. In Europe, for example, there are estimated about 400 million people who will require a treatment for disability, and especially with musculoskeletal disorders. In Italy, we are implementing a model named Health Resort Medicine, being located in appropriate facilities for patients with disabilities, supported from the Italian Minister of Health, with the goal of integrating it into the national healthcare pathways. This innovative model involves a multidisciplinary team and promotes the integration of conventional rehabilitation therapies and traditional and complementary medicine in a multimodal therapies and program aimed prevention and treatment of chronic disabilities. The model incorporates a range of interventions, including natural therapy with mineral water in different modalities like therapy or drinking or inhalation or aquatic exercise or manipulation, combined with psychological and cognitive intervention, physical agent modalities such as electrotherapy, ultrasound, or laser, as well as various approaches like acupuncture, yoga, herbal medicine, homeopathy, Ayurveda, and ozone therapy. Special emphasis is placed on patients' education and lifestyle modification in order to proactively prevent the onset of chronic disease and disabilities and social and the natural environment where many facilities are located, given the beneficial impacts of surroundings and health promotion patients' well-being, as evidenced in recent literature. This model can be useful in a lot of patients with disabilities arising from diverse conditions like, for example, musculoskeletal, neurological, oncological, cardiorespiratory, digestive, and metabolic disorders. Our model is characterized by three key features. Point one, integration of approach. This stance is a cornerstone of our model. This model offers the integrated traditional and the complementary medicine with rehabilitation intervention in a pragmatic and interprofessional and personalized approach, ensuring comprehensive care in all the aspects of defined disability: physical, emotional, spiritual, psychological, and social aspects. Point two, continuity of care. Our model includes entire spectrum of health and illness care, embracing a comprehensive perspective. Point three, centralization of care. This model offers the patients an integrated health center, avoiding a fragmentation of care. And in the last slide, I have summarized some action that I consider to be fundamental for the development and dissemination of these integrated comprehensive models. Point one, to stabilize and enhance networks between conventional treatment and rehabilitation centers, such as hospitals or clinics, and the local and traditional facilities. Point two, promoting the dissemination and diffusion of these integrated models to facilitate their incorporation into various healthcare contexts, the exchange of information and best practices among diverse stakeholders and the healthcare professionals, including local community members, patients, organizations, and associations, is crucial. And finally, to stimulate the definition of international evidence-based guidelines through the collaboration between research centers and the university across different countries, with the aim of developing recommendations for integrative healthcare practice based on rigorous scientific research and an ethical approach. Thank you for your attention.
Thank you very much, Dr. Maziero, from that perspective that bring connection directly from Hippocrates' times with the water as an element of the curative element. Then you move now, again, from European perspective, but more broad, because Dr. Chido von Schonangere, you bring the framing of definition for traditional complementary integrative healthcare. It's a huge topic, more than considered from one country, but a global perspective. Thank you very much. Dr. Chido is the vice president of the International Federation of Anthroposophic Medical Association and has an integrative pediatric practice in Geneva. Thank you very much.
Thank you very much, Ricardo. Dear delegates, so I'm representing and speaking here for the Traditional Complementary and Integrative Healthcare Coalition, and of which the International Federation of Anthroposophic Medical Association is a co-sponsor. And I'm not Dr. Hans Kluge, because people keep coming up to me and asking me questions that only the WHO Euro Director can answer. So some background, this People's Declaration for Traditional Complementary and Integrative Healthcare is a coalition of now more than 300 organizations worldwide that we founded last year, and it represents practitioners, users, researchers, and educators. We call for respectful collaboration between traditional complementary and biomedical practices, and we ask for access to TCIH as part of the right to health. And we were very pleased that Dr. Tedros and his team invited us for a civil society dialogue in the run-up for this summit, and where we were able to present a number of asks that I cannot present to you today. And today is a very auspicious day for our coalition, because two of our members that are here in the hall have their birthday. So happy birthday. It's a very auspicious day for us. So I was asked to talk about this question of definition, and understand people have been discussing this for 30 years. So current definitions, we have traditional medicine. This is a very comprehensive definition. It gives a clear link to cultures. The complementary medicine definition, as you see, it's really defined a lot what it's not. It's not traditional medicine. It's not conventional medicine. And it brings on in a geographic perspective in terms of, you call traditional what's from your culture and complementary what's from abroad. There's one aspect in that current definition that is problematic and that probably needs to be looked at, and that's this last part of the sentence that's called, and are not fully integrated into the dominant healthcare system. That poses a problem because, of course, we want to integrate now, but it would mean once complementary medicine is integrated, it's still not traditional, it's still not conventional, but according to this definition, it would lose its existence or identity. So that's a problem. TNCM, as you know, is a merger of those two definitions, which is helpful because I think it eliminates a little bit this somewhat artificial distinction on geographic origin. Now, and my colleague Heather Boone will talk more about a new term that is under development, the definition under development, integration of TNCM into health system. term traditional, complementary, and integrative healthcare that comprises all traditional medicine, complementary medicine, and integrative medicine activities, services, and resources intended to promote, restore, or maintain health and well-being. It emphasizes cultural context, people-centered care, collaboration between diverse health practitioners, and a positive vision of health that integrates physical, mental, spiritual, and social well-being. We propose from civil society the term healthcare because health, it puts really health in the center, and it's a broad umbrella that really covers all the activities and practitioners, while medicine has quite a notation on pathology and treatment. Now we know that the perspectives are different across different regions. And I think the term medicine is problematic in some regions where if you're not a doctor, you're actually not allowed to say you're doing medicine. While from others, the perspective is medicine has been brought, help to professionalize really this field and give us a certain status. So we think healthcare encompasses it all, and underneath you still have the term medicine as traditional complementary medicine. And what you see here is we propose to lift this aspect of an approach of this holistic care really into this umbrella definition. You still would need to define integrative medicine a bit simultaneously now, and I will not do this in the time that is up now for me. But we have some proposals for that. And then the last one, we really use actually what WHO has already defined. People-centered care, health practitioners, these are clearly defined terms. Also the integrating physical, mental, spiritual, and social well-being is from the well-being framework that was approved by the World Health Assembly this year. So we hope this is helping the way forward, but I think it will be difficult in this field to have consensus. So at some point, we need the help of WHO to hear the different perspective and to move forward, define it, so we can actually use the terms appropriately. So next steps, clearly further consultations, and looking forward to your input. Thank you very much.
Thank you very much, Dr. Chido. And we hope to have at least 10 minutes at the end to the discussion of the audit that will be presented. And in the seconds and following that big discussion, we have now the presentation from Heather Boone from Canada. Heather Boone's Vice Provost, Faculty and Academy Life at the University of Toronto. He belongs to the group that developed that big discussion in WHO. Thanks, Heather, and bring your wisdom, please.
Thanks so much. I've been asked to speak briefly and to share some considerations for member states that are working to integrate traditional and complementary medicine into their healthcare systems. I also want to start with a draft definition. This is a term that we don't actually have a definition for, this concept of integration into healthcare systems. And it's something that I've been working with the WHO. And this, in fact, this entire presentation, including the work on this definition, have been sponsored by the Traditional and Complementary and Integrative Medicine Unit of the WHO. It's actually up to each individual member state to decide whether or how to integrate traditional and complementary medicine into their healthcare system. And obviously this decision is going to be framed based on a number of factors, including what kinds of traditional and complementary medicine providers are available in the country, the population need and demand, and the individual culture, as well as the knowledge base that exists for clinical effectiveness and safety with respect to the use of traditional and complementary medicine practices and products. But once that decision is made, one of the things that we've been thinking a lot about is, what does integration into a healthcare system look like? So some key considerations for a country that has made a decision that they wish to do this integration include things like government leadership. It's quite clear that some kind of leadership is necessary, but not sufficient for integration. So governments can create a framework or a policy or an organizational structure which encourages collaboration between providers of traditional and complementary medicine and conventional medicine. But in addition to any of these political decisions, a key component of integration into the healthcare system is that the providers need to learn to work together. And one of the challenges in all of this is that integration, the systems that are being integrated, the healthcare providers' practices that are being integrated, may be rooted in paradigms that have different underlying ontologies or assumptions about reality and epistemologies or ways of knowing. And so one thing to think about if one is attempting to integrate traditional and complementary medicine into one's healthcare system is how are these different ways of knowing or different forms of evidence, how are they going to be acknowledged and brought together in the implementation of any kind of integrated healthcare system? Clearly, there's no single model of integration, and there are many different examples of ways that countries have begun to integrate traditional and complementary medicine into their healthcare systems that we can all learn from. These models may be thought of along a continuum from, at one end, models which focus mostly on integration that's consumer-led, where consumers are doing the majority of the integration, right through to countries where the integration is much more top-down or systemic and being led from the healthcare system perspective. And as was mentioned earlier, if we think about the building blocks of the healthcare system, it's important, you can go through each building block and think about what are some of the issues that one needs to think about in an integrated system. So in this brief presentation, I'll just mention a few. Leadership and governance, I've mentioned this already. Government recognition is something that appears to be necessary, but not sufficient for an integrated system. With respect to health system financing, it's important to think about whether and how one will establish equitable funding for traditional and complementary medicine practices as well as conventional medical practices and services and products. One will also need to think about providers of the healthcare system. How will they be trained? How will we do research into their practices? And how will we create a system where the practitioners can be facilitated to collaborate together, to work collaboratively together to enhance people's health and well-being? How will we ensure that people experience seamless continuity of care from a wide diversity of healthcare providers? And from a health information systems perspective, how will the structures such as billing and charting and health referral systems, how will they be set up to support collaboration across all healthcare providers? With respect to health products, vaccines, and technologies, how will these be regulated in an equitable and appropriate manner? And how will we think about essential medicines lists and whether traditional and complementary medicine products should be included in those lists where appropriate? How will we ensure that patients have an access to a wide range of health products with assured quality, safety, efficacy, and effectiveness? So we've been thinking a lot about these things, and the next steps include, for example, working under the guidance of the TCI unit from the WHO to complete a report with the objectives that are on the screen. We want to continue our work with an international group of experts to incorporate feedback into the draft report, which has already been created, but we need to do more work on the development of a tool that will enable countries to self-assess the level of integration of traditional and complementary medicine in their current healthcare systems, and to help them measure progress towards whatever goal they identify for themselves. And this will need additional consultation across all of the WHO regions once it has been drafted. Thank you.
Thank you very much, Heather. To bring, I think you arrive until the mountain, now you go down. Because from now, we will go to the presentation of experience from several countries. We'll start now with Thailand experience presented from Dr. Dong Chai, Director, General Director of Department of Thai Traditional and Alternative Medicine. Please, Dr. Thai.
Namaste, distinguished guests, ladies and gentlemen. First, I would like to thank the organizing committee for giving me the opportunity to participate in this significant event and to share the 20-year experience of Thailand in integrating traditional medicine into its health system. Let me start with showing you the current situation of the integration of Thai traditional medicine, which I will call TTM in short, with conventional medicine service in public health service system. TTM services include traditional and herbal medicine listed in the National List of Essential Herbal Medicine, Nuot Thai or traditional Thai massage for therapeutic and rehabilitative purposes, hot herbal compassion, herbal steam bath, and postpartum care. These services are covered by all three health security systems of Thailand, namely Universal Health Coverage Scheme, Social Security Scheme, and Civil Servant Medical Benefit Scheme. Currently, there are about 3,600 Thai traditional medicine doctors employed by the Ministry of Public Health. TDM services are provided in over 10,000 public health service facilities in all levels across the country. In the primary health care facility, where there are no TTM doctor, at least there are selected herbal medicine items for common and minor illnesses available for other healthcare personnel to prescribe for the patient. Over the past 5 years, about 18 to 20% of all outpatient visits receive Thai traditional and alternative medicine services. These remarkable progresses have been because Thai has strong and continuous national policy to harness the wisdom of Thai traditional medicine and indigenous medicine in the health service system over 20 years. The significant first step was the establishment of the Department of Thai Traditional and Alternative Medicine and the National Office in October 2002, followed about a month later by the promulgation of the National Health Security Act that made the beginning of the country universal health coverage system, include Thai traditional and alternative medicine as part of the health services covered by USC. To enhance the patient across to TTM, the National Health Security Office has continuously allocated on top per capita budget for public health, offering traditional and alternative medicine services since 2007. Over the year, these budgets had grown sustainably, reaching in an impressive 19.16 baht per capita in 2023. One remarkable achievement in TTM service is the development of the National List of Essential Herbal Medicine. It began in 1999 as the list of the herbal medicine product with only 9 items under the National List of Essential Drugs. Over the year, to select more items of safe and effective medicine into the list, appropriate criteria were set for traditional medicine and for single herbal medicine based on history of the use in hospital and research evidence. In 2021, the national list of the essential herbal medicine was separate from the list of conventional medicine. And this year, the number has gone to 100 items. To promote the use of medicine in national list of essential herbal medicine and to implement the policy to replace certain items of conventional medicine with herbal medicines or to curb the misuse of antibiotics for viral infection in the national drug use campaign. It is necessary to provide clinical evidence and prescribing information to key prescribers, namely medical doctor and TTM doctor via appropriate channel. And if the evidence is still lacking, clinical research will be conducted to determine the efficacy and safety of potential herbal medicines. In summary, the success of integration of traditional medicine in the healthcare system require national policy and long-term commitment of the government and the Ministry of Public Health. Moreover, sharing evidence and related information on herbal medicine is imperative to promote better understanding and trust to the prescriber and user. Thank you for your attention.
Then following the experience we have now, the short presentation, but very important, answer the question about the experience and views on establishing integrative medicine programs in clinical centers in the background of integration of the traditional medicine in primary health care. Then I would like to invite Dr. Nesma Ali El-Abawi from Egypt to his presentation. Thank you.
Thank you. Firstly, thank you for this invitation and welcome everybody. Firstly, integrative medicine has been practiced since the old world civilizations. For example, pharaohs understand the individuals as whole, body, mind, spirit, considering that health implicates several factors. Several papyri documented general and different therapeutic approaches like surgery, natural and herbal remedies. Up till now, Egyptians, when feeling sick, sometimes recover with the help of primary health care only. So, in Egypt, guidelines for herbal medicine and its registration and Egyptian herbal monographs have been established to ensure safety, efficacy, and quality of the herbal medicines. In addition, medical centers used in therapeutic tourism help individuals from all over the world to alleviate their symptoms using natural resources such as sulfur water baths, mud, and hot water or hot sands. That which make us rediscover this type of holistic medication for implementation of the concept of the integrative medicine by setting regulations, organization, education, and training to achieve the universal health care for all of us. Thank you.
Sekaga Kagali. I hope that's pronounced properly. Not here? No? And Dr. Maria Edgan Sumivi from Indonesia. Thanks.
Thank you. Good afternoon, distinguished speakers and participants. Traditional medicine is an important and often underestimated part of health services. In Indonesia, it has been practiced since a long time ago, and we try to regulate and we try to integrate traditional medicine based on products, practices, and practitioners. So in Indonesia, traditional medicine products are regulated by the Indonesian Food and Drug Administration together with the Ministry of Health, while traditional practices and practitioners are regulated by the Ministry of Health. We believe that good regulation could guarantee good integration between TNCF and the conventional medicine. The government of Indonesia has issued government regulation concerning traditional health system, president regulation concerning national health system that include also traditional medicine, and presidential instruction concerning accelerating the development of the pharmaceutical and medical devices industries to emphasize traditional medicine as an integral part of the health system. In Indonesia, on the product, traditional medicine product is classified into jamu, standardized herbal medicine, and phytopharmacy. Jamu is supported by empirical data, traditional knowledge, or local wisdom. Standardized herbal medicine have preclinical data for safety and efficacy and produced using standardized raw material and products. Meanwhile, phytopharmacy have its safety and efficacy scientifically proven through clinical trials and produced using standardized raw material and products. Until now, we have 15,000 product of jamu, 81 product of standardized herbal medicine, and 22 product of phytopharmacy. We also issued phytopharmacy formulary for 5 classes of therapy based on phytopharmacy product category, including cardiovascular system, metabolic system, nutrition, gastrointestinal system, and immune system. The phytopharmacy formulary is expected to be able to increase the utilization of phytopharmacy, which will ultimately increase also research activities and phytopharmacy production in Indonesia. In terms of practice and practitioner, until 2022, we have 1,600 traditional health workers graduated from our traditional health school and 5,000 health workers, including medical doctors, nurses, and midwives that has traditional medicine competency, including acupuncture, acupressure, herbs, massage, and Ayurveda. And we have also 56 government hospital with trained herbal medic practitioner, 195 government hospital with trained acupuncture practitioners, and 2,400 community health center with trained acupressure practitioners, and 83 community health center with trained acupuncture practitioners. The challenge, of course, is to include this system into our insurance system. This required scientific evidence and standardization of traditional health services. Indonesia also now currently piloting hospital and wellness integrated services. One of the champion is the service that we have just created in Bali, which is called USADA, traditional medicine in Bali, together with our hospital. So you can visit Bali not only for the beach, but of course also for medical checkup and wellness with the traditional medicine in Bali. Indonesia hopes to integrate better conventional medicine with traditional and complementary medicine, and therefore we're thankful to WHO and the Indian government to conduct this global summit. And we have global summit in traditional medicine. We have learned a lot since yesterday and today to develop our system. Thank you very much.
Thank you. Dr. Maria encouraged us to go to that hospital on the beach. I perceive that. Thank you. And to concluding remarks, I would like to invite the Honorable Mr. Mohad Bahadur Mazdat, Minister of Health of Population of Nepal. Please. Thank you very much.
Session chair and co-panelist of the session, esteemed high-level invitees from different countries, scientists, practitioners, colleagues, and dear friends. I would like to commend the Government of India and WHO for organizing Traditional Medicine Global Summit 2023 with the theme Health and Well-being for All. It is my honor to address this panel on integrative health for well-being at all ages. Today, traditional and complementary medicine is well established in many parts of the world, where it plays an important role in the health and well-being of the communities. In Nepal, about 80% of the people live in rural areas and majority of them rely on traditional remedies for their health problems. Nepal is progressively investing towards comprehensive development of traditional medicines in addressing pressing health challenges. We stand committed to ensuring sufficient resources towards strengthening of traditional medicine infrastructures and services, use and promotion of ingenious medicine to support community health and global health coverage. As my co-panelists have already shared their experiences, best practice, and intervention in their respective countries, it is a high time that we all start considering the integration of traditional medicine into the healthcare system of our countries. This will definitely help us in achieving our set goal of universal health coverage. I urge everyone present in this forum to start working in this directions and put their maximum efforts in the promotion and integration of traditional medicine. I appeal the esteemed traditional medicine community scientists, practitioners, and all key stakeholders to amplify collaboration. I am confident that deliberations in this panel and in the summit will certainly explore newer avenues in traditional medicine and develop a common goal, agenda, and priorities. Nepal stands together with unwavering determination and shared commitment in this transformative journey. Thank you. Namaste.
After such important statements, I think you have only 5 minutes of questions because you have to come back at 2 o'clock. Then if you have any question, please raise your hand and please, yeah. It's okay. Well,
I'd like to congratulate the WHO and the Government of India for putting forth this particular event. I am a surgeon by profession. My name is Dr. Harihar Murthy. I come from Bangalore. My question to the Chief of Niti Aayog specifically is that complementary medicine is so necessary to bring about a holistic result in the patient care delivery. How do we bridge the trust deficit that exists between different systems, which is a reality on the ground? We have a very good discussion going on here about how we can bring about a synthesis. But my question is specifically to you, sir, because that will drive the policy and perhaps the delivery on the ground. Thank you.
Respond? Okay, let me respond. Thank you very much. This is a very important issue indeed. The trust deficit, shall we say, which keeps us apart. I think the answer to this is to start working together, enabled by national and a government facilitation. Both are important. One is what are the pathways of working together? And what I have attempted here is that if you divide the work areas, education, research, clinical practice, public health, I'm giving you some examples of how practical way forward can happen, and that brings people together. You start working together for a cause, and then there's traction from the people, traction from the stakeholders. But the second part is truly also that an environment should be created, and the government has a role to play where the bridging effort happens. For example, when we have a leader like the Honorable Prime Minister who constantly reminds us about the strength of traditional medicine and describes how to work together in a holistic way, and then it emanates through the leadership, it emanates through some of the work that the organizations do, we will come together. I think the only way forward is to work together, because today it's not me or, it is us together. It'll take time. Society has to rise to the occasion. Professional leaderships from all these streams also have to rise to the occasion. Thank you.
I think you can have only now one question, then have the 5 minutes yoga, and then the next question I will propose that can be done after conclude the section, because we have to conclude. Then the last question, please.
Thank you very much. Thank you very much, Ricardo. And thank you very much for the excellent presentations. I would like to make a comment related to integration of traditional medicine into national health systems. In addition to what the presenter has said, and she rightly said that government political will is not enough, which will be explicitly demonstrated through development of national policies and legislation, regulatory systems of traditional complementary integrative medicine practitioners and providers, as well as practices and products, regulatory systems for education of both traditional health practitioners and conventional health practitioners. And there must be also a coordinated approach for the services that are provided by both traditional health practitioners and conventional health practitioners, as it has been done in China, in Japan, Democratic Republic of Korea, and Republic of Korea, which have fully integrated traditional medicine into national health systems. Of course, it's a long journey, but we have to start from somewhere, and some countries are already doing that. Thank you.
Thank you very much, Ossi. I think we don't have time to discuss this because we could have a new panel. Then thank you very much for our speakers. I bring a lot of impressive questions. I think from now I have a lot of work to do and about integration. Thank you very much. And I invite everybody to do the yoga section now, 5 minutes. Thank you.
Thank you. Namaste. I welcome you all in this yoga break. It will get you de-stress, refresh, and refocus. So please stand at your place with feet 2 inches apart. Join your both the arms in front of your chest. Interlock your fingers. Stretch your arms upwards and try to raise your heels if you can. Otherwise, you can stay there with raised arms. Inhale normally, exhale normally. Now, exhale, heels down. Place your interlocked arms on your head. Now again, inhale, raise your arms upwards. With exhalation, bend towards your right side.